Yes, it is Breast Cancer Awareness Month. Of course, it's annually held during October. Want to talk specifically about a type of breast cancer we do not talk about a lot. Of course, any diagnosis of breast cancer is bad news. When you have metastatic breast cancer, it can be especially bad news. But we're here today to try to spread some positivity because there is hope if you have been diagnosed with metastatic breast cancer. And joining me now is Dr. Susan Rabinowe. She's a medical oncologist at St. Francis, right down the road from our studios, which is part of the Smilow Cancer Center and the Yale Cancer Center. Doctor, thank you so much for joining us today. Pleasure to have you with us. I'm guessing the term metastatic breast cancer is something a lot of people have heard of, but they don't necessarily know what it means. So what does it mean?
So metastatic means that the cancer has spread outside the breast. It could have spread to the lungs or the liver or the bone or the brain.
Yeah.
And only about 5% of patients who present with breast cancer have metastatic disease. But if you look at all patients who develop breast cancer, about 30% can develop metastatic disease. And there are 160,000 women in the United States living with metastatic breast cancer.
Now, of course, speaking in very general terms, when it's cancer, the name of the game is to try to catch it as early as possible so it does not spread. And, well, metastatic breast cancer, by definition, has spread. What does that traditionally do to survival rates? 5-year, 10-year, long-term when you have metastatic breast cancer?
Clearly, that will shorten survival rates because we don't typically have a cure when it has spread. However, about 11% or more of patients who are under 65 with metastatic breast cancer can live for more than 10 years with the disease. And I personally have a patient who lived for 25 years. So there is hope.
Was that the case 5 years, 10 years, 20 years ago, or is that relatively new?
It wasn't, and I think it's because we have newer therapies to treat the disease. And really the important thing that we need to know when someone has metastatic breast cancer is what type do they have.
Yes.
There are different types, and so there's a type that has hormone receptors on it and does not have something called HER2/neu on it. There's another type that may have hormone receptors and HER2/neu.
Yeah.
Another type that won't have hormone receptors and has HER2/neu, and then there's a triple negative type that has no hormone receptors or HER2/neu, and we will treat those cancers differently.
Well, the triple negative type, is that one of the ones that has historically been a little harder to treat, or am I remembering
That has been. It tends to be more aggressive, but actually there was very exciting data this past year on an immune therapy, a therapy to harness a person's own immune system to kill cancer. It's called atezolizumab. And when that therapy was given with chemotherapy versus patients just getting chemo alone, in first-line treatment for metastatic disease, the overall survival was significantly better. So that agent was approved by the FDA, and so we're using it in those patients. So that's been very exciting, literally trying to harness the patient's own immune system to kill the cancer.
And I imagine, I'm just guessing here, because I hadn't heard of it until you mentioned it, that would help especially in the case of a breast cancer that has spread, because you're able to find it wherever it is, as opposed to a more localized treatment like radiation where it has to be in one particular spot, right?
That is very true. We do utilize radiation in selected patients with metastatic disease who may have an area in the bone in the back that's causing them a problem, for example. But the treatment I just mentioned is a systemic treatment. It's given intravenously. The problem is with many of these treatments, they can't go to the brain. Our brains have a protective barrier. So most of our therapies don't go there. So we do need to have some additional innovations and improvements in that therapy, and we're working on that.
So these are a lot of the things you need to keep in mind. God forbid you or anybody you know gets diagnosed with breast cancer, especially metastatic. You may know it as stage 4 breast cancer. There are options. There is a lot more hope now than there was at pretty much any other time in human history. And people like Dr. Rabinowe and all the great researchers and treaters are doing such a wonderful job. Any last thoughts?
I just want to add one other thing, that there was very exciting data from a big meeting in Europe, an international meeting, that showed for hormone receptor positive breast cancer patients who have metastatic disease, and it's HER2 negative, that inhibitors called cyclin D kinase inhibitors improved overall survival when they were given with hormonal therapy. That was very exciting data. And the median overall survival wasn't even reached for patients who got this additional therapy. So there's a lot of excitement happening, and I think it's important for patients to consider going on clinical trials of these newer agents, because that's how we advance the treatments and improve outcomes for patients.
Yes, that makes sense. And again, not to be sort of vulgar with this, but when you're on stage 4, there's less of a worry about downside. You need to be able to try whatever's available out there, even if it's at the clinical trial stage. Yes. Dr. Rabinowe, thank you so much for taking the time to be with us today.
Pleasure.
I love whenever we can try to spread some positivity to a bad situation. That is wonderful. Now, still ahead on the Fox 61 Morning News.